Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back to Aging in Place Strategies and Answers with Linda Prio. As we move into the month of November, I am grateful that you have allowed me to share this valuable information with you. And I ask that you, in turn, would share this information with someone that you know who would be grateful to receive it. We all need a friend from time to time who can help point us in the right direction. Be that friend. In previous episodes, I have mentioned the professionals that you will need on your team to help you as you age in place independently and safely. I also promised to talk about affordable care options and housing for those who will need these options as they age in place. Seniors who earn less than $30,000 per year are considered lower income. That number accounts for about 40% of all seniors. Financial help for seniors includes assistance with healthcare, housing, nutrition, and general grants, and we're going to be talking about some of those as we go through this podcast. It is important to note that even those with a solid financial plan could possibly divest themselves of most of their assets in the last years of their life. Let me repeat that one more time. Even those with a solid financial plan, due to changes in their healthcare status and their desire to age in place at home or to retain their quality of life, might possibly divest themselves of most of their assets in the last years of their life. Whether you decide to stay at home or move into a community, you will be using cash and assets that you have saved for a rainy day. This is why planning is so important. It is also important to know when the rainy day that you saved for has arrived. What do I mean by that? Many times I hear adult children say, "My parents have been very cautious and very careful, and they have saved their money and are hesitant to spend it." Unfortunately, I have had to tell them that this is the rainy day that they have been saving for. In other words, their health needs have changed. We are seeing an increased need for care, and it is time to start spending that cash. I have also had clients tell me that they have long-term care insurance, but they are hesitant to activate it. Each long-term care insurance policy is different, but when you need full-time care or even ongoing care, or decide to move into a community and not just a few hours 2 to 3 times a week, it is time to call the insurance company and find out how to start a claim. Knowing when it is time to move into a community or knowing when to file a claim for the long-term care insurance policy, or even discover how much care is needed to be successful, is why you consult professionals. This is the best way to help with decision making. Too often, people try to put a Band-Aid on a gaping wound, and you and I both know that that doesn't work. It is far better to start with more care, and then as your loved one improves, scale back. And in many cases, you can start a long-term care insurance claim and stop it when the person is feeling better. Now, I don't like to spend money unnecessarily, and I bet you don't either. But there is a misconception that healthcare is free. In my years of working with clients and case managers, we all learn something very quickly. Patients seem to have a preconceived notion that their insurance will pay for everything and they will not have any out-of-pocket costs. In some cases, it seems as if people think they're at a car dealership asking for free options or refusing to pay dealer costs. There is no golden ticket in healthcare. In order to choose the aging in place option you want, you need to gather information on costs. And fortunately, most financial planners and elder care attorneys are using life planning strategies to help their clients with documents and financial vehicles that can help long term. I do not think that I will ever forget meeting with the wife of a client who was completing a skilled rehab stay. The wife had warned me that her husband was one tough cookie and that he didn't like to spend any money. I assured her that I had met his type before, but the professional recommendation in his particular case was that he either go home with private pay care set up or stay in the community as a private pay client. Well, the spouse knew he needed care if he came home, but she also knew he wouldn't agree to spending the money. On the other hand, he wanted to go home and not stay in the community. And that's why I was called in to negotiate this very difficult place. During our meeting, I couldn't tell if the mister was sleeping or was completely out of it because he was acting as if he was unresponsive. His eyes were closed, he was nonverbal, and he didn't seem to be involved in the meeting at all until I mentioned the cost of care. As soon as I mentioned the pricing, Mr. was wide awake and alert, and I can tell you that was kind of startling after his initial response in the meeting. Well, I think you know how this turned out. He refused to sign the paperwork, and so did the wife, even though she knew he wanted to come home and needed the care. But he made his decision not to spend the money with me, but he still had to spend the money if he was staying in the community. So, again, what is the gain here? This is not a game. You're being offered choices, and you need to figure out what your response is going to be to those choices. My friends, again, there are no freebies in healthcare, so it is important that you get educated and you know your options. Today we're going to begin talking about affordable medical care options and extra help programs for those with chronic conditions. We will identify and share information about new programming being offered in underserved communities and begin a discussion on affordable housing options to help those with limited resources. We have already learned that medical insurance can vary from state to state and county to county. Do you remember me talking about that beautiful, fact-filled, easy-to-read Medicare and You book sent out to all Medicare recipients? Did you already toss yours in the trash? Well, most of the information that I'm going to share with you today is in that guide. So if you already trashed it, then you're going to need to go to Medicare.gov and learn the particulars of affordable care for your state. It is important to note that some states have more state-funded care options for those with low incomes. Check with your state to see what your state offers and find the best place to get care if you have limited resources. Several years ago, I was having a discussion with a woman who moved from Iowa to Missouri. I was explaining the costs of a program that would help with light housekeeping and transportation. And she said that she had that in Iowa and she didn't have to pay a thing. Well, what could I say? I said, "Welcome to Missouri?" Question mark, question mark. I said, "I'm sorry, but Missouri does not have a program like that for someone at her income level." But when I did a little research, I found out that there are plenty of states that have additional entitlement programming. California, New York, Texas, Pennsylvania, Florida, Ohio, Illinois, and Massachusetts offer many, many entitlement programs. As usual, before we begin our discussion, we need to understand several terms and learn to use them correctly. When we know correct terminology, then we are more likely to get correct answers. We have heard this term before, but I'm going to give you the definition of Medicare again. Medicare is a federal health insurance for people 65 or older and some younger people with disabilities or people with end-stage renal disease. Medicaid is a joint federal and state program that helps with medical costs for some people with limited income and in some cases, resources. We have also discussed Medicare Advantage plans, but it's important that we review this information one more time because many social workers, case managers, and others are putting more folks who are dual eligible, Medicare plus Medicaid, into Medicare Advantage plans as a strategy to help that person be able to afford care. Now, remember that in some Medicare Advantage plans, you can only use doctors and providers who are in the plan's network and service area. But each plan varies, so you need to know the specifics of each plan and compare. You may need to get a referral to use a specialist. Out-of-pocket costs do exist, and they vary from plan to plan. Part B premiums could be paid by the plan you choose, or you might have to pay part of your Part B premium. Most Medicare Advantage plans include drug coverage, and most plans have a limit on out-of-pocket spending. So, again, you have heard me say that there are costs to insurance products. So it's important that you know what you're being offered and what your out-of-pocket's going to be, or every time you visit the doctor, what that might be costing you, or when you're in the hospital. The individual plan will have detailed information, so always look that information over. In many areas of the United States, managed care companies are setting up clinics in underserved areas so that it is easier for their insureds to find an insurance plan that works best for them and then help them access care. These managed care plans are able to establish clinics in underserved areas and also provide transportation to the clinic. The insured, when they sign up, will meet with a clinic manager who learns their medical history, their diagnosis or diagnoses, and what their health goals are. That clinic manager will also be able to help guide them into a plan that will work well for their particular health care needs. Within these clinics, the patient has access to primary care doctors, face-to-face and telehealth visits. They have diagnostic testing available there, nutritional counseling, and also are able to enjoy activities in the community room. Another program that was around when I began my marketing career in healthcare was the PACE program, which I thought was really brilliant. PACE stands for Program of All-Inclusive Care for the Elderly. It is a Medicare and Medicaid program offered in many states that allows people who would really need nursing home level of care to remain in the community. This is an awesome program for folks who are dual eligible and meet the financial requirements. Unfortunately, many of these programs have suffered from spiraling costs, management, and lack of education in the community, as well as competition. And in many cases, they're only in larger communities. These PACE programs always had a daytime adult daycare that could help provide nursing care and medical oversight. They offered transportation, lunch, activities, hearing, podiatry, vision, as well as physical and occupational therapy. These programs were very successful in keeping folks at home who really should have been in a long-term care community but enjoyed living safely and independently. If the person you know needs a program like this, you're going to need to look in your state and in your area. But if you don't find anything like that, look for these clinics that are being offered by major managed care providers like United Healthcare, Anthem, CVS, Optum, and others. Another program that is very helpful for seniors is called Meals on Wheels, and it is usually run locally, and in my particular area, the Aging Ahead Senior Centers are in charge of these programs. But Meals on Wheels are available to persons 60 years of age or older, regardless of income, who are homebound because of an illness, a disability, or would have difficulty obtaining food or meals for themselves. There is also a program called a Special Needs Program. And this program provides benefits and services to people with specific diseases. This program can be especially helpful for folks with end-stage renal disease, diabetes, HIV, AIDS, chronic heart failure, or dementia. Again, geography will dictate the type of benefit and coverage available. There is also the EBT or SNAP program, which is a monthly benefit to make food more affordable for people. There is also a state pharmaceutical assistance program, and this benefit is based on financial need, age, or medical condition, but it can also help seniors get help with their drugs. SSI is a Social Security income. It is a help to those who are blind or disabled and have limited income and resources. If you're over 65 and not disabled, this SSI income must be met financially. There is also something starting January 1st, 2024, and it's called Extra Help. And they are going to expand to cover more drug costs for certain people with limited income and resources. Now, when we're looking at programs like this, it's nice to be aware of what kind of resources they're looking at. What will they be checking on to see if I qualify for a program like this? Well, they will definitely be looking at the checking accounts, the savings accounts, any stocks, bonds, mutual funds, or IRAs, but they will not include home, car, household items, burial plot, or if you have a burial or life insurance policy. Thank you for hanging in there with me as we have gone through some new terminology. I completely understand how hard it is to be a caregiver for someone with limited resources and then struggling to figure out where to begin to look for what they need. And it does take a lot of time and energy away from everything else that you are doing. But you and I both understand and realize that many times people in our lives need this help. So I felt it was very important to give you as much information about healthcare and meals and things like that so that you would know that these things exist. Now, when we meet again, we're going to be talking about affordable care options. These will be options that actually provide hands-on care. And we are also going to be talking about affordable housing, which is all part of the aging in place strategy for someone with limited resources. But here's the good news that I want to share with you today as we end. Every state has a state health insurance assistance program that will help you learn and understand your Medicare rights. By the way, that phone number is on the back of that Medicare and You book I keep mentioning. SHIP is what it's known as, offers free personalized help with your Medicare questions. If you're experiencing any problems with your billing or have complaints about your medical care or any treatment you've received, they can also offer you a plan comparison and enrollment, and they can explain how Medicare works with other insurance. In addition, they can give options to help assist you in paying healthcare costs. This is a free service and it is unbiased. So here again, the State Health Insurance Assistance Program can be your best friend as you try to navigate care for someone in your life or yourself and you have limited resources. Thank you for joining me today. Don't forget to check out my premium content, and I look forward to being with you again as we get educated on aging in place, strategies and answers. Thank you for joining me today. Please remember that this podcast is intended as guidance and not advice. Share this podcast with friends and family who are currently in crisis mode or with people who would like to start developing their own roadmap for aging in place. Listeners, if you would like a deeper dive into a topic discussed during a podcast, please subscribe to Aging in Place Strategies and Answers, where you will be able to access premium content. Or if you would like to suggest a topic for this podcast, please contact me at linda.agingstrategies@gmail.com. As always, I value the time you spend with me.